This is SG2 Perspectives, a conversation with industry experts and SG2 thought leaders about the biggest trends in healthcare and what we all expect that's going to mean for the future of healthcare delivery.
Unless you were well capitalized and had a lot of liquidity, you're basically going to be looking at cutting costs pretty actively at the health system and already are. And that's not going to escape their employed physician groups. There's going to have to be restructuring for a lot of health systems with respect to their physician networks.
Hello and welcome to SG2 Perspectives. I am your host, Kelly Richard. Today we'll be discussing how COVID-19 is likely to impact the physician landscape. I have with me on the podcast today Dr. David DiLoreto, principal on our consulting team with years of experience practicing medicine and serving in an executive capacity, and Mike Strilesky, also a principal on our consulting team with extensive expertise in healthcare strategy, particularly physician alignment and value-based care. Thank you both for joining me today.
It's my pleasure. Hi, Mike. Hi, Kelly.
Hey, David. Hi, Kelly. Nice to talk to you guys today.
Today's episode, How COVID-19 is Reshaping the Physician Landscape, is a two-part series. For part one, we're going to focus on the challenges the pandemic poses for physician practices and how care delivery is evolving. So just to set the context a little bit here, much of the COVID-19 focus regarding providers has been on hospitals being overwhelmed with COVID-19 patients in the inpatient setting. However, physician practices, particularly independent physicians, although also health system-owned practices, primary care and specialty practices that operate largely outside of hospitals have also been impacted through drastic reductions in patient volumes and subsequently revenue. So we're hearing about furloughs, layoffs for these practices. And while it initially seems counterintuitive given the narrative of the overwhelmed health system, why are these practices struggling so much?
Kelly, you know that as part of the pandemic mitigation efforts, there were a lot of things put in place that essentially have shut down large aspects of the U.S. economy. And so even though physician practices were essential services, almost all physician practices have actually struggled with demand destruction. And in primary care practices, it's probably as much as 50 to 60% decrease in encounters over the last 2 months. Many of those practices were actually using virtual health services to actually provide care. And for specialty practices, it's been as much as 60 to 70%. So like all service industries, there really was no exception for these physician practices, and they've actually taken very significant hits over the last 2 months. Many of them operate on fairly narrow margins. They're not always well capitalized. And like other service industries, they may have 30 days of available funds. And so it's been necessary for them to take some really unfortunate measures to furlough or lay off staff, to take pay reductions themselves. So it's a really, really significant problem.
David, what I would add to that, because I think you captured all of the main points. I mean, the basic issue here is the physician practices are small businesses. So just like this crisis has impacted all small businesses across the country, physician practices are cash-based. So, the interesting, dynamic is when they stopped seeing patients, the revenue didn't necessarily stop coming in because all of the cash that they use to run their businesses is off of obviously their accounts receivable. So once they shut down, they had to quickly cut their expenses because where they're going to start feeling that pinch is in the next 60 days and 90 days as they run through their AR from the previous months and try to deal with the decrease in AR that they're going to have in future months based on this low volume, right? So they don't have retained earnings for the most part. And really, just given the timing of this, which is kind of another dynamic, a lot of practices tap their line of credit beginning of the year to sort of reconcile 2019 and bonuses and even potentially recruitment or retirement issues that happened at the end of the year. So it was really not a great time of the year for this to happen for a lot of physician practices. So that's why you're hearing, I think, a lot of them struggling.
That's really helpful considering the small business financial aspect of these smaller groups. There have been some stopgap measures put in place to help particularly independent providers by CMS. They provided advance payment and they're offering forgivable loans. Some of them are removing the barriers to telehealth access and reimbursement. Are those measures enough?
Well, I think in some ways, there's certainly, I think, a little bit more than what a lot of small businesses across the country received. So, I mean, at some level, healthcare was elevated in terms of its importance, understandably, during this crisis, right, Kelly? Whether it's the CARES Act, the Paycheck Protection Program, healthcare enhancement, advanced payments, those kinds of things, a combination of loan and grants. I think the number is around 175 billion was sent to healthcare providers during this period of time, right? So a lot of money directed towards providers. Now, but that includes hospitals, health systems, right? So if we just assume, around 15% of that went to physician practices, that's about 26 billion divided by the number of physicians that potentially are eligible. It's around $30,000 per physician.
That's not going to last very long.
Yeah, right. So I guess to my point earlier, they're sort of getting that now, but they've been drawing on their accounts receivable. So I think most physician practices, the ones that were proactive in cutting expenses, and whether it's furloughing or laying off staff permanently, restructuring their expenses, leases, things like that, to essentially build up cash during this period of time to navigate the recovery period. They're going to need that cash as they start to bring their employees back to cover the operating expenses that are going to be immediate. And their AR is not going to be sufficient because it will have been depressed because their volume has gone down over the last couple months or more.
Yeah, I would agree, Mike, that practices that were able to preserve some liquidity in the last few months are going to be a little bit better shape. But with respect to the assistance they've gotten from federal intervention, it does help with cash flow for a little while, but it's clearly not enough. Until there's a reasonably functioning economy, practices are going to be at risk. So for instance, CMS demonstrated a lot of flexibility with respect to telemedicine and virtual health services. They increased reimbursement. They expanded indications and sites of service, and even pay for audio-only virtual health services for Medicare Advantage patients. The problem is that revenue for those services isn't to the same level that face-to-face visits are. Plus, the practices are not able to do in-office testing or imaging, things that are important revenue sources for them. Even with the flexibility that's been demonstrated, there are things that were missed. So, for instance, the audio-only virtual health visits that can be provided to Medicare Advantage patients, those codes don't allow the HCC scoring to be done. And so those scores are going to be depressed from the services that are being provided right now. I think it's something that CMS will get around to addressing. But the reality is, until there's something that looks more like the economy in February of this year, these practices are going to be seeing decreased revenue.
Yeah. And so I think sort of what we're hearing from the two of you is that some of them can prepare by having extra cash on hand, kind of cutting their expenses. But if this really starts to stretch out for months or years and patients are just not coming back at the same rate, are we looking at a totally different landscape here? Could we see physicians retiring early? Will there be more physician shortages, greater use of mid-levels? Could patients go to alternative sites? What does that high-level landscape start to look like?
Well, it really depends on several factors. What we're seeing right now is that as large-scale social distancing is relaxed, folks are not actually engaging in services the same way. So, for instance, there's some surveys this week of patient likelihood to return for visits to providers. Only about 50% said that they are willing to go see a primary care physician at this point in time, which is actually much better because only about 30% say they will go to an ER or see a specialist. So there's no doubt that demand destruction is going to continue because of fear, particularly among folks who are at high risk, folks over 65, those with multiple comorbidities. They're going to continue to self-quarantine to various degrees. And as a result, I think we'll see continuation of the use of virtual health services. There's some concern now that screening and preventive services are are not being provided. So folks are looking at new ways to do that. A hospital near me here in Chicago, actually, you can drive up and get vaccinations from your car. They've got the nurses out in the parking lot, and they've got a computer on wheels, and basically you're getting services now in very different ways. And I think we'll probably see that continue. Folks in the workforce, physicians or not, who are at risk, those 65 and older, folks with multiple comorbidities, they're going to continue to use some forms of social distancing going forward. For instance, there's an ED group that I've been working with in New Orleans. The average age of the providers in the mid-50s, and they have a number 65 and older. And what they've done actually is moved those physicians 65 and over. They can self-select to do this. They work from home doing the tele-ED visits. And so I think we will see some disruption in the workforce related to this, as well as efforts at contact tracing and identification lead to vertical isolation of populations. That's going to disrupt the workforce as well. It reminds me of another time in New Orleans when I was there after Hurricane Katrina, where demand for services went to zero because all the practices were closed and all the hospitals were closed. And then even as the city returned, the floodwaters weren't there anymore. Folks came back in drips and droves, and because they had to get their houses, rehabbed or rebuilt. It took about 2 years to get to a baseline of demand, and the baseline of demand was about 30% less than it was before the storm. And so practices actually had to experience significant disruption during then. And depending on the length of time of this pandemic, and obviously with the uncertainty right now about how long it will be or how demand will actually increase, there's generally going to be some disruption. It would not surprise me to see physicians begin to retire early, and other healthcare workers may as well. And I think we will see changes in how delivery occurs. You'll see, obviously, I think more team-based care. The virtual health workflows are, not fully efficient in practices right now. A lot of practices actually find that it takes longer to do virtual health visits. That can be addressed with workflow improvements, obviously, and I think we will see larger panel sizes develop, but they'll take some work to do that. With respect to alternative sites of care, there's no doubt that preventive services, screening services, things that can be done either virtually or with limited face-to-face contact will be used more actively. And most of the health systems I'm talking to today do not expect to see ED volumes really come anywhere close to what they were before the outbreak of the pandemic, at least in the current year. Many of them actually looking at 20 to 30 to even up to 40% decrease in demand for ED services.
So do you see a specific impact on health systems in terms of losing, or at least just the changing the way that their frontline providers bring patients into their facilities?
I think changing is probably the point I would emphasize here, right? That certain sites are being emphasized and are more important. Potentially that's some low acuity access, or as David sort of talked about, the shift to virtual pretty aggressively and the decline in emergency demand. I mean, at the end of the day, if the demand exceeds the ability for health systems and providers to sort of meet that volume at the front line, that's devastating. But I don't hear that today, David. I'm not sure if you're hearing any concerns about that at the moment. I mean, I certainly think there's maybe a longer term concern as physicians and providers retire out, but is there any concern today that you're seeing?
I think it's really, we're still in a state where we don't know how the demand is going to return, and folks are starting to forecast that way. I do have health system clients who, believe elective surgeries will be probably decreased at least 20 to 30% for the rest of the year. Probably the most optimistic forecast that I've seen on the elective surgery is a system that believes it'll only be decreased 5%. But the impact on the workforce, I think, still needs to play out. And there'll be some fluidity too. And a lot of it will depend on the second and third waves that potentially could emerge, as long as the virus is circulating and there isn't effective therapies or a vaccine.
I think that makes sense. Generally speaking, I'm probably more optimistic that we're going to come out sort of on the other side of this with the healthcare worker and provider and physician sort of being celebrated at a level that maybe they haven't been celebrated before or in sort of recent history. And I think that's actually going to help attract people to the profession that might have chosen a different path. I think there will be opportunities, both sort of new opportunities will emerge, new roles. I think reimbursement payment could get modified to ensure that there's sort of appropriate parity for level of effort and shortages in certain areas to make sure that we shore those up. So I kind of feel I'm probably more optimistic about the sort of the workforce dynamics following this, just given the attention that will be paid to it.
Oh, I think you're absolutely right. When this passes, New York City needs to have the biggest ticker tape parade ever for frontline healthcare workers. And they need to include the folks who are delivering groceries and packages to us as well. They really do need to be celebrated.
Agreed. Essential businesses, both in healthcare and beyond, are serving all of us by risking their own health every day. Furthermore, they're in the challenging position of developing new and innovative ways to conduct business in a totally different environment. And this is certainly true of physician practices who are balancing the financial challenges as well as innovating on new care delivery strategies. Well, thank you, Mike and David, for joining me today. This has been part one of our two-part episode on how COVID-19 is reshaping the physician landscape. Please also listen to part two to hear David, Mike, and I discuss changes in physician alignment and innovative business models. If you like what you're hearing, please also listen and subscribe to our colleague Tom Villanueva's Modern Practice podcast on Vizient's Medical Leadership channel. Tom discusses key healthcare trends through the clinical leadership lens. You can find it wherever you listen to podcasts. Thank you for listening and stay healthy.
This has been another great episode of SG2 Perspectives, where industry experts and SG2 thought leaders explore the drivers of tomorrow's healthcare strategies to inform today's decision makers. Contact us anytime by sending an email to sg2perspectives@sg2.com. We'd love to hear from you. SG2 revolutionized healthcare demand forecasting with the Impact of Change forecast, and today we're the industry's premier strategy advisory firm. To learn more, visit sg2.com. Thanks so much for listening, and we'll see you again soon.